This is Mrs. Palmer-Quay, and this is the third video for Unit 4.1. In this video, I'm going to talk about two types of skin damage, a little more practical approach than some of the other videos that were information. In this video, we're going to be talking about burns and skin cancer. First, let's start with burns. The definition of a burn is that there's tissue damage and resulting in cell death due to either heat, excessive heat, electricity, radiation, which includes sunlight or ultraviolet rays, or chemicals. And I found a chart over here that shows the emergency room admissions for burns, and the first one, heat, takes up more than half. These are all thermal burns, and then scalding is included in that because the scalding is when it's moist heat as compared to dry heat. So really it's heat in all forms that are causing burns for most people. There are life-threatening consequences that can come from a burn, especially a severe burn. If you remember the information on wound healing, once cells are destroyed, it starts a whole chain of events that lead to inflammation and fluids being released from capillaries that become leaky. In a situation of a burn where the outer integrity of the skin has been lost, that you can have the fluid and then the ions, the electrolytes, actually leaving the body, seeping out because they're no longer being able to be stopped by the outer surface of the skin, which also can lead to increased evaporation from the surface tissues because the skin and its coating of the keratinized cells provides a prevention of any kind of evaporation. So overall, burns can lead to greater dehydration and affect your circulatory system to a great extent, depending upon how severe they are. Along with the issues concerning fluid, losing your skin barrier, and as part of the whole response to this wound, you can end up with a depressed immune system. You're not able to respond as well to pathogens being introduced into the body, and the end result of that then is a greater risk of infection. So there are serious consequences from burns. I'm sure you've heard of the three different types of burns, first, second, or third degree. First and second degree burns are known as partial thickness burns. In a first degree burn, only the epidermis is damaged, so it's not a very serious situation. In a second degree burn, you have injury both to the epidermis and to the upper dermis, and these terms should be familiar to you as you're learning about the skin. Signs of a second degree burn are blisters, a red appearance that can be quite painful. But in both the cases of first and second degree burns, you can have regeneration of the lost tissue because you still have epithelial cells, remember these are the mitotic cells, to recreate the skin that you have had lost or damaged by a burn. So here are some diagrams of what a first and second degree burn would look like. Okay, here we've got the tiny little dark layer on the top is the epidermis, and then we've got our dermis, and then you can see the fat here for the subcutaneous or hypodermic layer, and then down here on the bottom we have the muscles. So in the first degree burn, you can see that we only are damaging the very, very top layer, just the epidermis. And if you remember from the discussion of hair, the epidermal cells actually go down here along the hair follicles. And so there are cells, epithelial cells, that are waiting, you could say, maybe, protected down there in the dermis. So if you do lose a little bit of epidermal tissue, you still have some cells here that can divide and reproduce that missing piece. Here's a second degree burn, so it's the same type of picture. You can see now we're going much further down into the dermis, but we haven't reached the hypodermis or the subcutaneous level or down to the muscle or bone. So it still is staying in the upper layers or the cutaneous membrane of the skin. Here are some pictures of first and second degree burns. Probably they're very familiar to you. Sunburn, everybody probably has at least seen, if not personally experienced, sunburn. You may have had a blistered burn if you hit a hot pot or some other situation like that, barbecuing or such. So this is the typical appearance of first and second degree burns. The third-degree burn is known as a full-thickness burn because it destroys the entire thickness of skin right down through the subcutaneous level. Interestingly, it can initially not be as painful because the nerve endings have been destroyed. It also can look red or white or black, so there can be some variation in the appearance. Because you have lost the epidermis, it is not possible to have regeneration from the wound healing from itself, so you're going to have skin grafts. They can be skin grafts coming from a part of your own skin, another part of your body, depending upon how large this third-degree burn is. But also there are a number now of skin substitutes and other things that can be done in the medical world to provide a skin graft for someone who needs it. Burns that are over 20 to 25% of the body will require fluid supplementation given intravenously, and burns over 30% may be fatal without any treatment. Of course, anything over 40% for sure is going to need treatment for the person to survive. So here's the same illustration showing that the third-degree burn has gotten down into the subcutaneous level and actually has touched the muscles down here. So it is a full-thickness burn. And then we have an illustration over here of someone who has suffered such a burn on their ankle. So to figure out how much of the body has been burned, medical professionals use what's known as the rule of nines, and basically they've taken chunks of the body and divided them up as to be equal to a 9% coverage. So if you have a burn on the torso here, it's 9% of your body, or both of your arms together would be 9%, or all the way around your head would be 9%. So it's a quick way to calculate what percentage of the body is covered. The rule of nines, on the way it's shown in these diagrams, is set up for adults. Since the proportions on children are different, their heads are larger, their legs are smaller, there are actually different proportion rules for children. So this is the rule of nines for adults, and it just shows you that basically the body has been divided up into sections, and each is considered about 9% of the total surface area. To keep this practical, what's the first aid for burns? Well, if you have a minor burn, so these are the first-degree burns, or a small second-degree burn, a burn of about 3 inches across or smaller, you want to try to cool the burn, remove the heat so the tissues are not overheated or damaged by any excess heat. So you can use cool running water or cool compresses or soak in cool water, but realize you're not using ice, no ice, because this can further damage the tissue. It's not a good idea to put ice directly on your skin in any situation. You always want to moderate it by wrapping it in a washcloth or something so you don't have that directly on your skin, but especially in this case here with the burn. Then once the burn has been cooled, you want to cover with sterile gauze. Some of the old-fashioned methods of putting on butter are really not recommended. Cool off the burn and then just cover it with a sterile dressing. Watch for signs of infection, especially if it was a small second-degree burn where you've breached down into the dermal layer. And of course, if you've got pain, take a painkiller as needed. In the case of third-degree burns, large second-degree burns or third-degree burns, call for medical attention or go to the emergency room. But if you should happen to be in this situation, don't try to take away the burn closing. Don't put the people or parts of the body into cold water. You want to avoid stressing the body any more than it already is, so you want to not try to cool them off anymore. You want to keep an eye on circulation, breathing, heart rate. If you see that the person has stopped breathing, you can begin CPR, or if you're familiar with that process. It's also helpful to elevate the parts of the body that are burned to above heart level. This allows the fluid to remain or return to the heart better. It improves the circulation. And to cover the area of the burn is the last thing to do while you're waiting for other medical help. Here you can use things that are cool and moist. Just don't immerse the person in water. So moving on to our second topic, onto skin cancer. Since sunburn is one type of burn, we have found a strong correlation between ultraviolet radiation exposure and sunburn with skin cancer. There also is a connection between different chemicals, or in some cases repeated infections that cause irritation to the skin or stressing out the skin cells in a certain place, and skin cancer. But by and large, the greatest contribution to skin cancer comes from people enjoying the sun a little bit too much. There are 3 types of skin cancer. You probably have heard these names: squamous cell carcinoma, basal cell carcinoma, and melanoma. And now that you've learned a little bit about the skin, I hope you can kind of picture the squamous cell. Where's that carcinoma coming from? What cells are involved? Or the basal cell, the basal layer or the basale layer of your skin. 1 out of every 5 Americans will develop skin cancer in their lifetime. Right now, it's the most common form of cancer here in the United States. And I myself and my husband both have experienced it. I'll talk about that as we go on. Basal cell carcinoma is the least malignant, and it is the most common type. So the stratum basale cells are the ones that are continuing on in mitosis beyond what they are supposed to do to produce the next layer of cells for your skin. It's usually seen on older adults on parts of the body that have had a long-term sun exposure, so the face, the hands, parts of the skin that have seen the sun for a long time. Here's just one illustration of what it might look like. Here's another one here. These tend to be less obvious. They're more pale, slightly elevated. And basal cell carcinomas are slower growing, much less likely to metastasize, can easily be removed surgically. The squamous cell carcinomas come from the keratinocytes. These are the cells that are adding keratin on their way to becoming dead, tough, keratinized cells on the outside of your skin, from the stratum spinosum, which is that second layer coming up from the newly developed cells. This one's a little more dangerous. It may metastasize, but it also is caused by long-term sun exposure. So parts of the body that see a lot of the sun, especially the face, the nose, the lip, are prime sites for squamous cell carcinoma. So we have a little bit on a nose here, and here's a close-up from some other part of the body. These tend to be a little more obvious that something is wrong. There may be a little bit more redness to them, or in both of these cases you can see that the top sort of seems broken. But again, surgery or possibly radiation can lead to a full cure and treatment. Then we get to melanoma, which is the nasty one when it comes to skin cancer. Cancer of the melanocytes. About 5% of all skin cancers are melanomas, but the survival rate is only 50%. It's typically seen as a spreading patch of brown or black, a mole that has kind of gotten out of control, and it will metastasize to the blood or to the lymph nodes. It tends to end up in the lungs and the liver and starts other tumors there. What is interesting about melanoma is that it is not related to prolonged sun exposure. Right now the thinking is that just one intense exposure to sun, a solid sunburn at some point in your life, even if you never go out of doors again, may be the triggering factor for melanoma. It is treated by surgery and, if necessary, followed up with chemotherapy. And so we've got a variety of melanomas shown over here on the right. You can see that some are looking much darker than others. Some have a more of a reddish appearance in them, several different sizes, but these are all forms of melanoma. So we have this handy mnemonic known as the ABCD, and sometimes E is added, rule for identifying skin cancer. They're using melanoma as the example here, but any of these same things will be a warning sign for either squamous cell or basal cell carcinoma as well. The first warning sign, the A, is for asymmetry, which means if you draw a line right down through the middle of this suspicious patch on your skin, that it will not be symmetrical. The two sides will look slightly different. The B stands for border irregularity. That means that the border is not smooth, that it has some ins and outs, like you're looking at the outside of a map. The third one is color, that there's some difference in the color. See, we've got a darker black down here, but it's a lighter brown up here. So any kind of shading across a suspicious patch on your skin is also a warning sign, something to check it out. The D stands for diameter, greater than 1/4 of an inch, so a larger dark spot is more of a concern than a smaller one. And the E, which I do think is worth considering as to adding to this list, is has there been some change? Has there been evolution of a spot? So we see here it goes from small to much larger. It is wise for everyone to be aware of these 5 indicators that there may be something going on in your skin that could be a problem. Asymmetry, what does the border look like? Is it irregular? Color, is there some variation with the color? How large is this mole or spot? And has there been any change? With so much skin cancer part of the American life, it's very important for everyone to know their own skin. Know where moles are found on your body, check them periodically for any changes, and request a biopsy if you see anything suspicious. My own experience was that I noticed a mole on my calf that just didn't look right. There was some color and border irregularity. I went into the doctor. He said, "Oh, this doesn't look like anything. I think it's probably something benign." Did a biopsy, came back and said, "Oh, by the way, it's melanoma." I had it removed 3 years ago and I've not had a reoccurrence. My husband this summer had the same thing. I noticed a spot on his back, a mole that looked larger. It was larger than 1/4 of an inch. It just didn't look right. The color was a little bit off. The borders were smooth. It was fairly symmetrical, but it was just didn't appear to the same as the other moles. And again, he went in. The doctor said, "I don't think this is anything to worry about." Took a biopsy, and yes, it came back melanoma. And he had that removed. He now has a 4-inch scar on the back of his shoulder because what doctors do now when they remove for skin cancers, they take a good amount all around it so that we try to get clean margins. But the other part for preventing any kind of cancer is to have a healthy lifestyle. Eat healthy, high on those fruits and vegetables, stay fit, get enough sleep, take care of your stress. These things are all involved in creating a terrain inside your body that doesn't encourage the growth of cancer cells because it keeps your own immune system fit and they can get rid of those unhealthy cells before they get to be a problem. So that finishes this quick discussion of burns and cancer. I hope it's been interesting and I hope it will be practical to you at some point in your life, maybe not for this class, but maybe later on.